Welcome to Glaucoma Case Files here on site at NYU with Drs. Joe Panarelli and Manjool Shah. You know, I like this topic because in general, like when we talk about like trabs, like phaco trabs, I think there's enough evidence they probably don't function as well. So staging them is very reasonable. So we do run into this scenario where now you got to do the cataract. And sometimes it's like you're not going to mess with the trab, and then other times like there are other options to kind of deal with it at the time of phaco. So tell us a little bit just about the case.
Yeah, I think first and foremost is always being honest with yourself about how that bleb looks.
Yeah.
I think we all sort of copy and paste things forward, and it says diffuse bleb, and it's like, is it really a good bleb, or am I just lying to myself? And we're really hanging on. And so, you know, I think that's really first and foremost. You're kind of seeing there, and then you have to think about what your target pressure is for this patient. You know, I think you could do a really wonderful phaco and end up really getting burned, and that trab within, you know, a month, 2 months is going to end up not looking like it did beforehand. So I think
you're going to go up a little bit from where you're at.
Correct.
Right
Sometimes actually it's good. So for some of my patients with like
Right.
one of the best things is to do is just a clean phaco in those patients. I think don't forget that. But yeah, so I think if I have a well-functioning bleb, it's pretty routine. Get in there, do the phaco, 10 milligrams of 5-FU at week 1. And
So you do routinely like do an adjuvant at the time?
I do, and about 10 milligrams of 5-FU probably about month 1, and I hit them pretty hard with steroids. And so, and I do that pretty much no matter what.
Any pre-op steroids at all?
Nah, just sort of the routine stuff.
Okay.
Routine stuff. And I think, you know, in a situation like this where maybe, you know, I'm not loving the appearance of the bleb, I'm thinking I'm going to go and do a little bit of prophylactic needling. And now the question is, again, what kind of needling are we actually doing? And again, it comes back to what you think this bleb looks like. So are we talking about a ring of steel, or are we talking about flap fibrosis, where maybe there is some trickle of flow, but really the fibrosis is the flap is the issue?